Very excited for it. And briefly, before I turn it over to our presenter this evening, I am going to share my screen really quick. Hopefully you all can see that. Let me know in the chat box if you cannot, but you should see the lovely presenter, Deanna, on the screen right now. And for anybody that I do not know on tonight or who has not met me before, I'm Alex Herron, the Assistant Director of Alumni and Parent Engagement at Stetson University. Again, thank you all for joining us tonight. On the screen right there, just a couple things that I do within our office at Stetson. I get to work with our admissions team and kind of partner and kind of help network our current students and some prospective students and their families with alumni, parents, friends of the university, all that good stuff. So we do a lot of great work kind of partnering there, bringing everybody together, getting prospective students and their families questions answered about life at Stetson, life after Stetson, all that fun stuff. I get to work with our athletics department on all of their alumni efforts. And within the office, we've obviously, just like everybody else, have gone virtual for the time being. So we've had to adjust in that aspect. We're so used to doing awesome in-person events, and now we're doing as many really awesome and engaging virtual events as we can, like tonight. So that's just a little bit of the work that I get to do in the office. Ways you can stay engaged as an alumni, as a parent, as a friend of Stetson, whatever you are, ways you can stay engaged. And I will drop these links in the chat box in a few moments. The first way, you can fill out our webinar interest form. We kind of take the feedback we get on that form to build out all the content that comes out of our office. So anything as you as a community member want to see from our office, anything you want to see, let us know in that webinar interest form. We look at that feedback every week and kind of develop the future content from the office from there. Another thing you can do is check out our alumni website and the events tab in there. You can check out all the upcoming events out of our office. And then if you are an alum or a parent, friend of the university, whatever, update your alumni profile with us. That just helps us make sure we have the most up-to-date information on you. And like I said, I will drop all of those links in the chat box in just a moment. And then finally from me, just a couple housekeeping items. I know I mentioned earlier, if everybody could keep their microphones muted while Deanna is presenting, that would be great. That just helps prevent any kind of feedback or echoing on your end. And then this is Zoom. We typically use a different platform for some of our other webinars, but tonight we're on Zoom. So you obviously can control when your camera and microphone go on and off. Like I said, if you could please keep your microphone muted, keep your camera on as long as you want, but if you could, keep that microphone muted while she presents. If you have a question, feel free to drop it in the chat box. I'll be keeping an eye on that. And at the end, we'll kind of open it up to everybody to turn on your microphone and ask any questions or give any comments that you'd like. And with that, I will go ahead and turn it over to Deanna and let her take it away.
Thank you, Alex. I'm going to go ahead and get my screen shared here. Give me one moment. How's everyone doing tonight? Thank you so much for taking some time out of your day to listen to this information, and I hope that you will learn something new that will help you. Let's see here. Share. All right. So good evening. My name is Dr. Deanna Carol Smith. I'm a healthcare savings patient advocate. I'm a coach, a speaker, and I'm a pharmacist. I'm the founder and president of Appealing for URX, where we help people lower their healthcare costs through 3 methods. One of them is healthcare savings programs. Second is maximizing their current insurance benefits. And thirdly, by appealing. And so we'll be going over appealing today and learning how to appeal for uncovered healthcare costs and denied claims. So the objectives for tonight will be defining what appealing is if you're not familiar with that. We'll also, once again, we'll go over the appealing process for uncovered healthcare costs and denied treatments. It is very similar, but with the uncovered healthcare costs, we'll be appealing from your statement that you receive from your insurance company. And with the denied treatments, we will be talking about appealing when you have a prior authorization and how to appeal for that when you have a prior authorization denied. And lastly, I'll be going over how to get started with appealing and some tips that I have learned since starting to appeal. So I currently work for a pharmacy. Just a little bit of my background. I've been a pharmacist for over 20 years. I started off in retail with the big retail, and then I crossed over to what's considered specialty pharmacy. If you're not familiar with specialty pharmacy, we deal with chronic conditions like multiple sclerosis, psoriasis, cancer meds, a lot of rare conditions. And also our model is a little different. The medication is usually mailed to the patient versus in a retail setting where you can go up to the pharmacy and receive the medication. We also, a lot of medications are a lot of times refrigerated, and they usually almost always require a prior authorization. So that's a little bit of my background as far as pharmacy. All right, so how did I get started? I put this picture up here and my daughter was not very happy about it, but I like to say that I started appealing, it was kind of birthed into it. My daughter, who was born about 15 years ago, she came down the birth. I had a normal pregnancy by labor. I had no high blood pressure. I didn't have any diabetes the whole pregnancy. However, when I went into labor, Cheyenne, my daughter, went into distress, and it caused my blood pressure to go up. She came down the birth canal. She was passing meconium, and if you don't know what that is, that's the poop. When she was just, in distress coming down, it caused my body to, my blood pressure to go up. There was a lot of health concerns and risk at that time. So the doctors gave me medications to lower my high blood pressure. In the end, Cheyenne was delivered fine, delivery was fine, and we both ended up being okay. However, what happened was about 2 months later, I received in the mail what's considered the explanation of benefits statement. And we'll be going over in detail what that is if you're not familiar with that. And basically, just real short what it is what you receive from your insurance company when, after you've had some type of medical treatment, in my case, a hospital stay, from the labor. And it breaks down what they're going to pay and what I'll be responsible for. And so when I received mine, I'm a natural saver, and I was kind of familiar with what my amount was going to be. It was way over what I thought it was going to be. So I immediately called my insurance, and they were like, well, it looks like you stayed 3 days after having labor, after delivering your daughter, and you're only allowed 2 days. And I'm like, okay, well, I didn't know that. And I, explained to her what happened. I said, hey, my blood pressure went up. My first daughter, my first child, they were concerned about me going home with the meds that made me very sleepy. And so she said, oh, well, just let us know, write in a letter and we'll take a look at it. And sure enough, that's what I did. And they overturned that. And so I saved thousands and thousands of dollars just by looking at the explanation of benefits statement and taking the next step of appeal. So just, if I can go back here. Let's go back. Okay, so I just want to go over definition. What exactly is appealing? Appealing is simply asking your insurance to review your claim further to consider payment for the denied decision. In my case, it was with my daughter. I wrote a letter and asking them to reconsider paying for this, which they did. So these are a couple of reasons why I think people do not appeal. And these, I hear this all the time. And actually I've spoken to people and I see this in my practice now. I didn't mention this in the beginning, but outside of me writing this appeal letter for my daughter 15 years ago, I actually write appeal letters for a specialty pharmacy. So I do this on a regular for patients and for the doctors when they've been denied medications. I've been doing that now for about 4 or 5 years now. So have learned a lot in the last 5 years in different perspective of the different denials. So here are the reasons why I think people do not appeal. They don't think they're qualified to write the letter. They think only a doctor or lawyer can write the letter on their behalf. Medical terminology is sometimes intimidating and they don't really understand what to do. They think it's too hard and complicated, or they're just not aware. And like I said, I simply just wrote, I was a pharmacist at the time, but I actually wrote my first appeal letter as a concerned parent with a high medical bill. So, and I just simply, I didn't use any medical terms. I just kind of said, hey, This is what happened. Can you, take a look at this? And so sure enough, that's what happened. And I was able to save a lot of money. I just wanted to go over briefly some statistics about appealing. On the bottom right here, this is one I want you to kind of zone in on. This stated that only 2% of healthcare providers and consumers actually take the appeal process, actually go through the appeal process and write a letter, or sometimes that can be verbal. It doesn't have to necessarily be a letter. Sometimes it's just a verbal communication with your insurance company. However, 75% is overturned. This kind of lets us know that that's a high rate of you taking those next steps. On the top left, there was an article that said, not appealing is a lost opportunity. If you've been denied some type of medical treatment and you don't know that you can take these next steps, or your doctor didn't do that, and you are at, missing out on increasing your quality of life or having access to treatment, it is a lost opportunity. Lastly, in this study, it shows that findings show that consumers can get coverage for the care they need after appealing. Another article that I thought was very interesting over here to the right top here, it stated, where I go again, one back. Going too fast. Sorry about that, guys. Okay. Among other findings, reports showed consumers rarely appeal claims that have been denied. This is from a study in 2017. It stated that there were 42 million claims insurance companies denied, and only 200,000 consumers actually took steps of appeal. And that's only 0.05%. And as we saw earlier, the numbers, it depends on the study or the article you should read, the numbers are roughly in the same. This one said 75%. This was with a particular Medicare plan. This one over here on the left has 39 to 59% of approvals being overturned, of appeals being overturned. So the numbers are fairly in our favor. It's not high, but it's not necessarily low. So you can save a lot of money by doing the appeal process, and it also helps you have access to treatment that's been denied. Just taking a little effort into going through that if it's something that you or your loved one or someone that you know may benefit from. So I'm going to go, there's a couple of few definitions. I'm going to go into a little bit deeper. The first one is an explanation of benefit statement. I've kind of mentioned that already, what that was. Another name for that is called EOB, or I like to say it'll come in the mail from your insurance company. It says, this is not a bill. And so I wanted to share with you the story about this family. And it's just kind of, it's in the family what we're speaking about. But I wanted to share with you about a family that made this, we're just going to change gears and talk about this family that had a recipe for delicious pot roast. They lived in a small town and they were known for their pot roast. And whether it was a church event, whether it was a carnival or a fundraiser, they were always making this pot roast. It was delicious. And it went from generation to generation to generation. Well, one day, a little girl was at one of the fundraisers where this family that was always cooking this pot roast tasted the pot roast. She was an aspiring chef, and she was like, oh my gosh, this pot roast is so delicious. Can you share the recipe with me? And they were like, the great-granddaughter was like, well, I know you're trying to be a chef, so yeah, I'll share it with you. She said, listen up. So the little girl listened up, and the daughter said, the first thing you do is you cut the pot roast in half. Second, you season it with onion powder, garlic powder, pepper, and salt, and you place it in the oven for 250 degrees for 6 to 8 hours. And she says, all you do. And so the girl was like, wow. And then she kind of looked at her puzzled, and she said, may I ask a question? Why do you guys cut the pot roast in half? And so the great-granddaughter was like, she didn't know. And so she said, you know what? My grandmother is still living. I'm going to ask her this weekend. So she drives to go see her grandmother who's in a nursing home. And she says, Grandma Jo, why do we cut the pot roast in half? And she said, oh, honey, we cut it in half because our ovens were too small then. So I say this story because a lot of times we take things at face value, like our explanation of benefit statement, and we say it's not a bill, and we move it to the side. And just like this family, they had no idea why they were cutting the roast beef in half. They're just taking it at its value and not even doing anything different. And you can say, this is where I've saved the most money, is looking at my explanation of benefit statement. So this is where I encourage people to save money, and then it also gives you your instructions for appealing. The other definitions I have here are prior authorizations. We'll go over that. Healthcare provider is like your doctor, your nurse practitioner, podiatrist, anyone that's giving you care and that can bill for insurance for the care they've given you. The prior authorization of the PA is a process that a healthcare provider must obtain in advance before an approval of a medical service. And lastly, the appealing, we talked about this. Let's see here. Okay, so here's my next slide. I'm just going over the explanation of benefits statement. This is not a bill. And like I said, this is just where I've saved the most money, is paying attention to my explanation of benefits statement. I wanted to share with you some sample explanation of benefit statements and how I have been able to save money with them. Here we go. Okay, so this is what comes in the mail from me. My insurance is Allegiance. There you have explanation of benefits. Here you go, this is not a statement. So I don't want you to move it to the side. I want you to pay attention to what it has on here. Here was the billed amount. It's negative. This isn't the best example to show you, but the billed amount is $95. There's always a billed amount. There's an amount that insurance pays, and there's an amount, for me, I have an HRA. This is where I teach people how also to understand their insurance. And HRA is a health reimbursement account, but won't focus on that right now, but the amount paid by my HRA, and then my financial responsibility. I love when it says zero. This one says zero. So the next page on mine, and this is where people probably get a little intimidated. This is my total charge. Here, there's an ineligible amount. A lot of times your insurance company is contracted with the doctor that you went to go see. And this amount has to be what the contracted amount is. So sometimes this is reduced. In my case, they were saying this whole amount is not a covered amount, and they're not going to pay anything, and that I don't have to pay anything either because it's an ineligible amount. So a lot of times people think the insurance is your enemy, but they're really your friend a lot of times if you are paying attention to what is going on with your explanation of benefits statement. But what I really want to look at on this here is where you can find the appeal process. So in your explanation of benefit statement, if you wanted to appeal, like in the case with my daughter, when I appealed that the hospital stay, it gives me my instructions. Appeal procedures are printed on the last page of this document. And just going to briefly go over that. So there are 3 steps that my insurance company allows. It's usually universal. You get a first level review, second level review, and then an external. Now, the first level, gratefully, you have the claim approved after the first level. If you're not sure how to get started and you're just, you can need more direction, make sure you call the 1-800 number that's on the back. You can always get instructions from the customer service at your insurance company. Also, make sure you're paying attention to this date. I have 180 days to appeal for the first level review, and that's a long time, but I don't recommend you sleeping on 180 days and taking your time. Second, if this one is denied, I get a second level of review. I have 60 days here. The instructions also go over, where to mail it. And lastly, I should have underlined this, but it says after you've exhausted the appeal process, I now can go to an external review. And that's a little bit further down. Here it is. It's either called an external review or an independent review organization, which is outside of your insurance company. So you give a few, you get a few tries, and it can be worth it depending on what's going on. I want to give you one more example of an example of how you can save money and not overpay when it comes to looking at your explanation of benefit statement. So this one's kind of out of order, but I want to show you what happened just recently. Okay, so this is an explanation of benefits, the same thing. This is for my son back in November. Um, Here we are, the insurance or the doctor's office, they billed $324. The amount paid by my plan was zero, so that's not good. However, I had money in my HRA, which is 125. Well, the total that I was responsible for was 125.02, and then my HRA paid it. And once again, zero. So I'm super happy about that. Go here again, there's that total charge. But however, they said, the contracted amount was $198 less. So make sure you look at that. I've seen sometimes where the doctor's office will try to bill you for the remaining, and they're not supposed to do that. So make sure you're paying attention to what your insurance is telling you that you should be responsible for. They're saying I'm responsible for 125.02. However, I have an HRA. I paid attention to that, and it says total amount paid by my HRA, which is down here. It's a health reimbursement account, and they paid that. But this is what happened. I looked at this and I knew that I was not supposed to pay. So what happened was, guess what? Advent Health still sent me a bill. Now, the date of service for my son was back in November. But look here, I'm getting a bill in March. I actually received a bill in January, February, and in March. I ignored it because I thought that the insurance paid for it, like I saw on the explanation of benefit statement, which they did. But I said, you know what, maybe it's just maybe it's just something they haven't been able to reconcile properly. So I called them, and Advent Health said, you know what, we didn't receive it. We didn't receive it. And so I called the insurance company. They said, hey, we sent them a check. So I'm in the middle here. My insurance is telling me that they paid, and Advent Health saying they didn't have the amount that was paid. So long story short, not sure if it was short, the Advent Health said, well, if you paid and they said they sent a check, let's see the check and, let's see if it was deposited. So sure enough, my insurance company, I've been loving my insurance company. They've been very helpful, actually. They actually gave me a copy of the check, and where Allegiance sent it to the doctor's office, which was Annalise, this doctor here, and it was deposited. So had I not taken those steps of looking at my explanation of benefit statement, when I would receive my bill in the mail from Advent, well, guess what? I would have just paid it because I would have thought it was due, but it wasn't. So we've reconciled this. It took me 4 months to finally get this all reconciled, but I didn't have to pay the 125.02, and so everything is good there. So I just wanted to share that with you. I'm going to go back to the slideshow. Okay. Once again, a prior authorization, this is that second definition where it requires your doctor or your healthcare provider to take an extra step. They need extra information. It could be a diagnosis. It could be wanting to know more about the patient's condition before they'll approve it. However, if it gets denied, then you can appeal. So a prior authorization, if you go to the pharmacy and they say, oh, well, it needed a prior authorization, sometimes the doctors, it depends on your doctor, will change it to something that doesn't need a prior authorization. But what I want to communicate to you is if you feel like the medication that the doctor wrote is the one that you prefer, make sure that they know it needs a prior authorization. They take those steps. Most doctors are familiar with that and will do that. However, if it becomes denied, a lot of doctors still take that step for you and appeal for you. But if not, and you want to do it on your own, we'll go over what you can do to start that appeal process. So here is this just kind of broken down within a denial for a prior authorization. Now, it doesn't have to just be for medication. It can also be for like a surgery. So suppose you have to get a prior approval for surgery and your insurance says, you know what, if we're, they did the prior authorization process and they denied it for whatever reason. And so you would have to go through possibly appealing. And like I said, sometimes doctors do this on their own. In specialty pharmacy, we see it a lot. The doctors do take the next steps, and that's where what I do is help the doctors too as well, draft a letter of appeal. So here we are. You have those three levels we talked about with appealing. So if the prior authorization is denied, We all want to get here with this young lady here who's excited that she had an approval. So if, they do the prior authorization, it's approved, we look like this, we're happy. So we're able to get have access to the treatment or the surgery or the medication that was needed in the prior authorization. However, if it's denied and we want to take those next level steps of appeal, there's the first level appeal. If it's denied, we can go to second level appeal, then so forth, all the way down to the external. And like I said, we want to get to the appeal being approved. Reasons why prior authorizations can be denied. A lot of information is the missing information. What's missing is missing. And it can be so simple. I've seen where I've had to write a letter of appeal because the prior authorization was denied for a wait. Now, some insurances will take a verbal, like over the phone, and say, hey, we denied it, we needed the wait, or we needed a diagnosis that didn't, we need to clarify something as far as the diagnosis. They'll take the verbal over the phone. So I do want to make sure you don't have to go straight into the appeal process. Always call first before going into that appeal process. It could be something that you can solve simply over the phone. Second, we see what's called step therapy. So if you have a prior authorization for medication, we see this with medication all the time, and they say, well, it's denied because of step therapy. And what that means is the doctor or the insurance company is stating that you must try drug A, B, and C before the D drug. And so I try to tell and help patients make sure they're documenting information as far as their past and tried and failed medications, because what's missing, sometimes this step therapy could have been resolved by you providing the missing information. Does that make sense? So you may have tried A, B, and C, but it wasn't submitted with the prior authorization, so now you've been denied, and you may have to go through the appeal process for not having that information in your records. Non-FDA approved Federal Drug Administration is what the FDA stands for. A lot of times there's a drug that is prescribed or even a treatment, and it's not approved through the FDA. And you're probably like, well, why would the doctor write it? A lot of times medications are used off-label, or they're in the process of approval. And so they want to get their patients started before the approval process. So I've written several on non-FDA approved. A lot of times this is going to require you to have some supporting documents, clinical studies to approve that. But those are very winnable as well. It just depends on your circumstance. And lastly, it's just not a covered benefit at all. A lot of times I've seen where there's certain drugs or just benefits that are not covered. However, you can still write that letter of appeal saying, you need this covered because of your situation. All right, and so these are the three things I believe that is so most helpful when writing an appeal, and hopefully can even prevent you from getting to the appeal process, is providing all your medical history, family history, social history to your healthcare provider, making sure it's documented. You can keep your own log. You don't have to depend on the doctor's office for that. One thing I highly recommend, if you're familiar with different portals or electronic medical records, they have those available now for you to sign in with your doctor's office portal system. You have access to the labs and the last notes. That's very helpful. Or you can keep your own log. And lastly, after you've submitted it and make sure it's documented, you want to make sure it's submitted. So we can have all this, but if that information is not submitted properly to the insurance company, then we still are left with a denial. So I just want to go over how to write a letter. Just like anything, you need to have the instructions and what you'll need to get started. Here I made like a little prescription pad. I'm not sure if you're familiar with the symbol RX. It's always on a prescription pad, and what it actually stands for in Latin is recipe. And so I'm going to give you the recipe for writing an appeal letter, a quality appeal letter. So you need to collect the necessary documents. Number one, if you don't have anything at all, is having the denial letter or the denial reason. Too many times, even on my team, what they'll do is say, hey, Deanna, it was denied, we need an appeal letter. And I'm like, they know not to even ask me until I see why the reason. I need to see it. So I prefer it unwritten, because they'll say, oh, it got denied because this patient needs to try this drug. Well, I need to see that, because if I write or draft the appeal letter towards that and it was something totally different, report was that plus something else, my chances of having that appeal letter overturned is going to be lower. So that is number one out of all documents, making sure it's not necessarily to be a document, but if you can't get the doc in writing, make sure you at least know why the insurance denied it. Authorization to release form. And what this is if someone else writes the letter on your behalf. Anyone can write the letter for you. Doctors write them for you, nurses, your pharmacists, your mom, your dad, your caregiver, your sister, whoever. You just have to let the insurance know that they're writing it on behalf of you. And then there's a appealing file form. That's not always necessary, but some insurance will just have you fill out something saying you want to appeal. And then, of course, we talked about supporting documents if necessary. I want to go over some tips to writing. It's not, what I like to tell people is like, it's not hard. Just write the letter in a business format. Don't overthink it, and just always address the denial reason. I spoke about that a second ago. You can write all you want about why you think it should be covered, but if you're not addressing the denial reason, then you are going to miss out on that overturned decision possibly. Providing supporting documents, x-rays, your prescriptions. If they're saying you need to try a certain medication and you have tried it, you can always get a printout or your doctor's records to show that you have tried it. And I state this to send your letter via certified mail. If you have to send it by mail, some doctors will allow you to fax it, and that's fine too. But the last thing you need to do is always follow up, whether you mail it, fax it, upload it to their system. Always follow up. I cannot tell you how many times the insurance will say they didn't receive it, and I don't know why. There's a lot of technology things going on a lot of times, and they didn't receive it. And then once they do receive it, make sure you follow up again to say, hey, when do you think you'll have a decision? I suggest always, writing down who you spoke to, when you spoke to them, and asking for a reference number. So when you call back again, you can always say, hey, I called around this time. I spoke to such and such, and here's my reference number. I'm following up on my appeal. One of the things I did go over that was on the slide for the prescription of how to write a letter, you need the ingredients, and then you need to get started with, how to write the letter. At the bottom of there, if I can go back to it, because I feel this is key, is a heap of patience, kindness, and honesty. A lot of times we're so frustrated with our healthcare costs or something being denied. When we call that insurance company, and I have experienced this, I'm upset. And the person on the other line is there to help you. So just know that sometimes it is a process. I've seen where appeals have been turned over within a couple of days, and I've seen where they have been turned over within 30 days. I will say, if you have an expedited reason, you can do you can provide an expedited letter of appeal, and they will put it towards the front. Well, they should. Just some other things to consider. We talked about, when you're in, a lot of times the insurance company has a checklist when it comes to if they'll cover something. When you're writing your letter of appeal, if you not having the medication, if you not having the treatment affects your quality of life, affects how you, function, make sure you put that in there. Make sure you're actually letting your doctor know that too, so they have that in your medical records, whether it's a daily activity, and it doesn't have to be a major activity. It can affect you doing certain things when you do a stroll or a walk, if anything like that. Other things, if the preferred medication that they want you to try, or for the step therapy, has a drug interaction. These are just things to consider when writing that letter of appeal that you can add to help support your reasons why it should be covered and why they should turn the decision around. We talked about the supporting articles. All right, so that concludes my presentation on appealing in that process. Here's my contact information, and Alex, can we open it up for questions? Is that our next step?
Yeah, absolutely. So if anybody has any questions or comments, feel free to unmute yourselves now, and you can ask them that way, or you can drop them in the chat box, whatever you prefer, but feel free. We'll open it up to questions and comments now. And just a couple for me that came up throughout. I know, now you've got experience doing this now, but are you still surprised at people if they come to you that just don't have any idea how any of this works still? Are you still surprised by that now?
Yeah, I am. Some people just don't know it's an option. I work in specialty pharmacy, so a lot of times we're doing this behind the scenes and the patient doesn't even know that it was denied.
Mhm.
So sometimes we're kind of proactive on it. But when I've talked to a couple people, they just were just unaware. And like, I wish I would have known this when I had my child 10 years ago, if they had, like a preemie birth or whatever, and they had to pay, extra. But you can, like I said, take extra steps and just explain, hey, this happened. Because they have protocols. It's not that they're their enemy. If they say their protocol is 2 days of treatment, of coverage in the hospital, but they have, something extra happens, then, they're not gonna see that, without you telling them.
Right. And then I guess a kind of a follow-up to that one is, do you also get people that might come to you for help or need help and they're just like, I don't know where to start, or I'm just so exhausted from the process that I don't even know if it's that it's worth it? And how do you kind of help people that might have that feeling of like, oh, is this even worth it to try and appeal?
I have not had that happen yet. So, but I would, if it did, I would, it just depends on, if the benefits are there for you. Like I said, it took me, 5 months? There's only $125, but I called the insurance company several times and, I didn't want to overpay. So it just depends on if you're okay with, if you don't need the treatment, if it's not, it just depends on how important it is to you or to your doctor, or how important it is to your health. So I think that's what's going to make the difference for you to keep on going, especially if it's a financial thing. Because we also help, outside of just appealing for, an uncovered cost or through your explanation of benefits. We also help through programs that can help you with your cost of your medication too. So those are also options for people that are in those scenarios.
Yeah. Well, thank you for that, answering to those questions. And before we close it out, if anybody has any final questions or comments, feel free to drop them in. But I am going to post in the chat box very quickly those links that I mentioned earlier. The first one you'll see is our webinar interest form. The second one is the link to our alumni website with all of our upcoming events. The third one is that alumni profile update. And then the fourth one in there that I am dropping in now is the link to Deanna's website if you want to learn more about her or any of the work that she does. And Christina, yes, just drop the chat in there. You have a quick question, feel free. You can either chat it in the chat box or you can go ahead and unmute yourself.
Okay, can you hear me okay?
Yes.
Okay, I do have a quick question. So in reference to the appeal process, is that only referring to like the aftermath, like something that wasn't covered? But what if you're told up front by your provider or your insurance company that this is not a covered cost and you're just going to have to pay up front? Does that fall in line with the appeal process, or do they actually have to deny something before you can go through that?
You can still go through the appeal without it being denied. I see that actually all the time. I have a couple of insurance companies that they say, oh, it's not a covered benefit, but just write a letter of medical necessity. Now I did cover that tonight, but it is very similar. It's actually, I write them pretty much almost identical. Instead of saying it's a letter of appeal for the denial, I say it's a letter of medical necessity for this reason. So, and you don't have to say letter of medical necessity, but you can say this treatment is warranted, appropriate because of this. So you can write a letter without it being denied, especially if it's just something up front that's not covered.
Okay, thank you.
All right.
Just make sure you ask your insurance though, like, okay, it's not covered. What steps can I take? Because every insurance is different.
Okay.
We will leave it to if anybody has any final questions or comments tonight. We did record tonight's session, so once we get that returned to us, I'll be sure to share that with anybody who needs it. And if at any point anything that you heard tonight kind of strikes you up again and you might want to learn more about it and you want to reach out to Deanna, if you didn't catch her contact information earlier, you can reach out to me directly here and I can kind of get you connected with her. But thank you, Deanna, for taking the time to do this with us. This was great information tonight.
Thank you. Thank you, Alex. I appreciate it.
Yeah, absolutely. So with that, we'll go ahead and close it out if anybody does not have any final questions. But again, thank you to everybody for joining. Thank you all for taking the time tonight. And I hope everybody stays safe and healthy right now. Thank you all.
Good night. Bye-bye.